Wellness Waves, a podcast by Fortis Healthcare to discuss health and wellness-related topics with nationally renowned experts from Fortis. Join us on this enlightening journey and ride the waves of wellness.
Sir, you have explained about anterior approach. Sir, can you just explain what is a direct anterior approach for hip replacement surgery?
Hip replacement, or for that matter, all the surgeries are done through cutting through the tissues to reach the point of our surgery. For example, in the hip replacement, traditionally, hip is approached through a cut on the side of the hip joint or through the posterior aspect or back of the hip joint. However, when you make a cut on the side or on the back of the hip joint, it involves cutting through a lot of vitals, important muscles of the hip joint. And also, if you damage these hip joints, if you damage these muscles, we may have problem in terms of rehabilitation, walking strength, the healing, bleeding, etc. And hence, in the direct anterior approach, instead of making a cut through the posterior or back of the hip joint or from the side of the hip joint, an incision or a cut is made through the front of the thigh. Advantage is that because you are cutting through the front of the hip joint, we can reach the hip joint without damaging any vital structures. What we call this as an internervous plane or an intermuscular plane. So the direct anterior approach, to be concise, involves making a smaller cut from the front of the hip joint rather than an extensive back incision or a side cut for the hip replacement surgery.